everybody. Welcome to Aging Strong, Tufts Medical Center's injury prevention and outreach program that's dedicated to sharing information and resources that empowers older adults. My name is Debbie Lynn Toomey, Tufts Medical Center's injury prevention coordinator. And this program is sponsored by the City of Quincy's Health Department. Today's topic is substance use disorder in the older population. And I was just reading something from the National Institute on Drug Abuse. And they started this beautiful article. It says, while illicit drug use typically declines after young adulthood, nearly 1 million adults age 65 and older with a substance use disorder is going up, as reported in the 2018 data. While the total number of substance use admissions to treatment facilities between the year 2000 and 2012 differed slightly, the proportion of admissions of older adults increased from 3.4% to 7.0% during that time. So it's really, it's pretty high, and it's something that needs to be discussed. And today's guests are Laura Martin, which is the Substance Use Disorder Services and Prevention Coordinator for the City of Quincy, and also Ari Martin, who is the Prevention Specialist for the City of Quincy. So welcome, Laura and Ari.
Hi, Ari is actually for Manat Community Health.
Thank you for that correction.
You're welcome.
Thank you.
I didn't want the mayor wondering when we hired a prevention specialist. But it would be a good tool to have.
Good point. So can you share with us, Laura, what do you do? What is that title? It's quite a mouthful. And who do you do it for?
Sure. It is a mouthful, but it's also important that it's inclusive. So substance use disorder services and prevention coordinator for the city. So I work in the mayor's office. And when I say work there, that's primarily where my office is. But really my job is to, work with our community partners, work with the police, the fire, all of the vital partners we have, like Manat Community Health, Bay State Community Services, the court systems, and to really just assess what the needs are from bottom up for substance use prevention, which means, looking at the programming we need in the schools and the community, healthy outlets for young kids, and then up to services, which we'll each talk a little bit about services, but services don't just mean placement and treatment. That's always for someone suffering with substance use disorder. That's always a part of it. But it's really it's detox, it's residential, it's outpatient, it's mental health. It's really, substance use and mental health disorder, it's one and the other, and mixed together, separate, and they really need to be handled kind of in a holistic wraparound way. So essentially, my job is to work and, be in the community and be available for people in the community or in the surrounding community. If you get a phone call from a family in distress, you're going to give them the information. And I'm grateful to be able to do that, but to also assess our ongoing needs and to educate, the mayor, city council, elected officials, but more important, the first responders and the community about what's going on out there with substances. We're in the middle of an opiate epidemic, which, I hate to say, but almost is at a pandemic level, and we are seeing extremely high drug use, the strength of the drugs, the fentanyl. So it's, sort of providing services and prevention is one thing, and that's, really great to hope for prevention, but the services is meeting people where they are and educating them like on what's going on out there and decreasing stigma. Especially right now, people are struggling. It's hard times out there for someone without a substance use disorder problem. So honestly, I mean, I feel like that was a long way of saying like it varies day to day. It's definitely not a desk job because it's about people and it's about being innovative and figuring out what we're missing in the community and then adding it, like I'm sitting here in this office, which is here now because we knew that the city needed a safe way to dispose of needles and to not just dispose of needles, but to meet substance users where they were and not make them have to use dirty needles and go to the pharmacy and experience that shame. But it's the connection, that we were able to have a mobile syringe exchange van. And then these individuals, like after that happens, my work is not done, but it's done in the fact that that service is being provided. And now I trust them to create a relationship with these individuals out in the community versus coming up to City Hall to talk to Laura Martin. I mean, don't get me wrong, that's one of the most beautiful parts of my job, but I also respect that there's different ways to connect, and I'm not always going to be the person that can directly do that, So, I mean, it's been innovative. When they first came to me with the idea, I was like, and then we just made it work because, like, you just read facts, right? We can't lie about facts. People are struggling and, like, they need these services. We need to change with the times. And I'm fortunate enough that the mayor is innovative and is open to that. And I have partners like police and fire and Marley. But I'll tell you, like, I couldn't give you a description because it changes every day because it needs to, like if we live in the past, we're going to keep losing a lot of people. So we talk openly, we share things that people don't want to hear. And that's my job. It's not like the coolest thing, like, oh, here's Marley to talk about this, or someone from the library to talk about all the books we have. Here's Laura to talk about how lethal the drugs are, but they're lethal, right? And like the beautiful thing about this is we have tools out there, and things like this are so essential to let people know. It's a disease that brings a lot of shame. It's a disease that, although as a community we work to stigmatize, there's still a lot of stigma around substance use disorder. You think, Ari? So just try and do all those things. And then I host community events. We have the overdose vigil, which is a beautiful thing, right? And like that's solely to celebrate people who've lost their battle to substance use disorder. And I use that just like as a time to remember those. I lost my brother over 17 years ago, and that's an important day for me to just remember and to also, realize like we're still fighting this thing and the numbers are getting higher and higher. And those are the facts, and we have them in hand. And I would say they're probably less reported wise than they are in actuality. But I work with basic community services on prevention programs, all the way up to providing direct services, talking to the first responders, hearing what they're hearing, letting people know, substance use disorder and like the way pills are right now, or cocaine, everything. You always have a risk for overdose, and I also just want to say really quickly, alcohol is still, that is one of the substances that people struggle with the most, So we think about the bigger drugs that have the quicker causes or more chaos, but we have to recognize all the things people struggle with to meet them where they are, and if we're only talking about opiates and we're only talking about fentanyl, like we're missing being able to let people out there that struggle with other substances know that we're here for them too. So that was a whirlwind of an explanation, and I'll let you ask any breakdown questions.
Oh, I love it. I love it. I'm glad you included alcohol in that description because, it seems to be more wildly accepted to be able to go out for a drink after work. So,
Sure.
not too many people, would see that as something to worry about until, people are going home drunk consistently and getting into accidents and, showing up for work late or maybe not showing up for work. So, there's the fine balance as far as that goes.
I mean, it's all, I say, like the disease of addiction. It's like, it's an obsession of mind, body. Like the difference between an alcoholic or a drug user is like, once they start, they can't stop, So when we say like, yes, like, has it been glamorized? Sure. Is there, during the pandemic, you had to have liquor stores open because people would have died from DTs and withdrawals. I mean, that's like kind of a crazy thing to think about. But we also had to have these services available, because like it's meeting people where they are. But on alcoholism, like as a country, sure. And in other countries, like, is it a little more normalized? 100%. But, it's the same. It may not look as harsh on the outside immediately than other substances, but it's still, that person is still suffering just as deeply. And it's still the same disease of addiction. We meet them the same place. You do the same assessment. Obviously, the direct services are different, but like, there is a distinction in that there's a different treatment methodology and things like that, but there isn't a distinction in that it's like that suffering that the person experiences. And, society comes in, we have marijuana now, and like many people have different beliefs on that. And like, it's the impact on the individual, and so as far as legal substances that you can purchase, illegal substances, now recreational or medical, it's the impact that it has on the person and their life and everything around them, and like you said, things start to slip a little bit, like the more people, the more their disease advances. Alcoholism tends to advance slower. You can be alcoholic for a very long period of time before your body catches up and the things start happening. But when they start happening, they usually start happening pretty quick. The body's resilient to a point.
Yeah. Good point. I know working in the trauma department at Tufts Medical Center, we get a lot of admissions with alcohol levels are like really high, and it's led because of that, it led to unintentional injuries or accidents, whatever it is. It could be a fall. It could be them coming out of a nightclub and, stabbing, or motor vehicle accidents, or, just so many different things, unintentional events that could occur because of that particular, the alcohol being in their system.
Yeah. And it even goes far. It goes prescription medications, misuse, overuse, underuse. There's always that opportunity for substances to have a negative impact because they impact not only your physical ability to control, but your emotional, your cognitive. You might race to make that red light and you wouldn't have otherwise. It just it diminishes your cognitive capacity and creates physical impairment. But I do think it's like really, really important to recognize that like so much of like, someone doesn't need to come in for an alcohol related medical issue or an overdose to have the reason for why they're presenting in the field, in the medical arena, related directly to their substance use. And like, that's where it's so important for education around signs to look for, when people are coming in, and it's that moment that might be the moment where the intervention or the seed can be planted or information can be given out, because it's often people suffer in silence for a very long time until it becomes so pronounced, that things are relevant. And I think for me, one of the biggest things we can do is talk about it early and often. And that's not, like you can't catch it. right? So people are like, well, don't talk about it, or doesn't need to, like, it's appropriate, like it's just like if you have a peanut allergy, stay away from those peanuts. If you have a predisposition to an adverse reaction to substance is in your family, in your community, based on, whatever's going on. I mean, I just think, why not put it out there early? We don't need to wait. Just like we plan economically, we plan when roads need to be done. Like, we need to plan and engage people with a solution before it gets that bad. Or if it has to get that bad, that they'll know where to go. And I don't know, and I'm probably expressing it pretty, but I really feel stigma, and decreasing that and educating people that don't have alcoholism, substance use disorder, on what it looks like, and that it's not the person being a bad person, right? They suffer. Because I think that has a lot to do with it. Because when you're under, anesthesia, or you come out of a surgery, like, no one trusts you with your own, like, whatever's going to happen. They monitor you. When you're on a substance, same type of stuff happens. So I don't know, my heart just like kind of weighs in that direction of talking about it, and not being ashamed of it, and respecting people's anonymity is so huge, but also like people getting out and, saying like, yeah, I have this and here I am. We do like a lot of celebrities, they promote it and stuff like that. And that's all like great and well, but like in the community, just like, because at the end of the day, right, like the Surgeon General said very clearly, it's a disease. And if someone is inflicted with another, tragic disease, we treat it as a disease. Prevention, screening, treatment. If it doesn't work, more treatment, family support. Like, it's, people have a hard time with that analogy, because parts of substance use disorder, there is that initial, action taken to choose to pick up the substance. But oftentimes it's after that, the choice is often taken away. So I know, I think that's important to say, like, the more we look at it the way that it's defined medically, the more people we can help, the more people that are going to, if someone has a suspicious mole, they're not going to be scared to go to the doctor and see if it's skin cancer because someone's going to judge them for liking the sun, so I went off a little bit, I tangent, but it seems like it was all going.
I'm with you. I'm following you. And so I can't agree more about, prevention early and often, making it so that if a person may not need that services or, the support at that time, you never know what life delivers, right? So
it's just putting more tools in people's toolbox,
Yeah.
and put it in their toolbox in case they run into someone that may need that,
Exactly. Yeah.
Not everyone's coming to City Hall or Manit to be educated on what to look for, so we got to get the message out there, screen it early, those signs to look for, talking to folks, like.
Yeah, and every level, not just the community, but going up to the people, the first responders, and people in the government, and everybody, so that everybody's got each other's back.
Yeah, and I will say, I mean, I'm blessed. I work with a lot of other communities, but the Quincy first responders, police, ambulance, they took on a lot of those roles early on with Narcan, and they provided it. They weren't going to fight, just like they wouldn't fight to hand someone a EpiPen if they had an allergic reaction. And that's been the support of the mayor and our strong, first responders and medical community. Because like at the end of the day, like, we take on those positions to help people, and it's changing and it's hard. We used to go to one overdose call at a homeless encampment every 2 months. They're going 10, 20, 30 times a day. And with the drugs out there right now, the fentanyl, how it's being mixed with other drugs that aren't typically IV intravenous drugs. It's being pressed into pills. That's important. You know, a lot of the older population, pill use, whether prescribed, unprescribed, whatever it is, you make sure that you're getting it from your pharmacy, from a doctor, from a bottle, because we have a high incidence of pills being pressed with fentanyl because the drug distributors, they know, it's cheaper, and has a greater impact, and that increases your clientele. So I think that's really another stigma decreaser, is that nothing can be trusted out there when it's purchased anywhere or when it's taken any way but prescribed. Just because you were prescribed a Xanax by your doctor, if your prescription runs out and someone in your family says, oh, well, I have these, and it came from the street and they think they're just purchasing a Xanax. I mean, that's the craziness. Like, people would be like, oh, that sounds so unrealistic. Not today. Pills are the police are constantly confiscating counterfeit pills, and they're, Adderall, Xanax, I mean, basically anything, Klonopin, all of these things that are marketed towards people with mental illness and substance use disorder. So we have to be really, really aware that, it's these things that it's like, oh, you never thought you'd have to talk about it, but you do. You never thought, like, you'd have to tell people how to revive someone that they find in their home, but we do. Just you call 911, but we have these tools. So it's definitely changing. I can look at all the bad sadness of that, or I choose to look at it as we have all these tools. So let's get the information out.
So let me just, as far as substance use disorder in older adults, what are you seeing now, as far as in comparison to before COVID and now? Are you seeing more of it? Are you seeing more people asking for help? Are you seeing more? What are you seeing?
Well, that's like also, so substance use across the board has increased, whether it's, alcohol is probably more prevalent in the older population, but that's just as prevalent with like advanced alcoholism occurring now, because you need to remember that during the pandemic, people that may have had, a habit on the weekends or drink when they got home, they were home all day. So all of a sudden, someone that started drinking when they got out of work at 6 o'clock is waking up at 7 in the morning, right? So like, alcoholism advanced, plus you have all of the confounding factors, insecurity about job, the economy, the world, like all those things. So 100%, like, alcohol sales skyrocketed during the pandemic. Also, though, you mix that with, people experiencing high levels of depression, suicidality, all of these things, right? And we're living in a world where, like, you can't necessarily get to the doctor's office. So what are you doing? You might be taking pills from the street, or you're self-medicating with more alcohol or more of a substance. So I just want to be careful to not say, like, it's only alcohol in older adults, because we see it on the gamut. Like, a lot of it, honestly, is like a lot of the overdose reports that I review, and the death certificates of toxicology is coming back, and it's like a cocktail. It's a mix, right? And ethanol, which would be alcohol, but then also benzodiazepine, and then fentanyl, cocaine. So we are seeing traditionally higher use, but the medical implications and the decline and need for intervention is happening much quicker because people are working at home. This is, alcoholism, if you're in recovery, relapses are skyrocketing. People's livelihoods have been, their sense of security, a lot of the things that they got sober for or didn't make that bad decision, or didn't make that decision or predisposition were their lives, and we lost that, so I think that just has to be recognized. And a lot of older adults, right, you've got to remember like isolation, but also like housing. So like a lot of older adults, a lot of families, where an individual with substance use disorder may not have been in the home, maybe they were imprisoned. The jails released a lot of people to their homes of their aging families. And we're also seeing a huge impact on the older population and caretaking for their grandchildren or other members. In their 60s or 70s, they're now responsible for a 2-year-old due to this pandemic. So, so that's use, direct, indirect. I mean, it's not a good picture, and I wish I had this kind of thing to say, oh, well, here are the numbers. We just don't know. We know that just like the pandemic impacted every single industry, this is a disease that thrives on isolation and chaos. We see it with the numbers. People weren't receiving care. Like for someone with chronic substance use disorder or with a very severe addiction, eyes on them is so important, connection. And we kind of lost that. We're getting it back, and like we're recognizing, but even priorities, all people were talking about was the pandemic. Yes, they should have. We've never been in the pandemic, right? But meanwhile, the overdose fatalities were just skyrocketing. And the numbers too, like we have to remember, the numbers do not do it. I shouldn't say justice. They're off, right? Because people are not calling EMS for overdoses. And it's a beautiful thing that we provide people with Narcan so they have it to save lives, but we cannot rely on the data. I'm never going to say, oh, maybe we shouldn't hand out as much Narcan so we can have the actual numbers. That does not matter. Narcan should be in every home. I believe it should be in every first aid kit, every public building. This is a life-saving medication. And our community is suffering. So I think it's, I'm not going to say for the sake of accurate reporting that we should do that. But people are struggling. And I think in the aging population, Debbie, alcoholism, of course, prescription medications, off-street medications, even family members that are now in their home that are stealing their medications or abusing their medications, financial abuse, physical, emotional abuse, added on burdens, loss of financial income. So, hey, prescriptions are expensive, right? Especially the older population on a fixed income. So that pill, you don't know what you don't know, and it could be so innocent. And those are some of the things to look for, but definitely the advancement and the admission rate for alcohol skyrocketed too during the pandemic. And like people talk about that during the pandemic, like we need to remember that that is another part of this, that it's just as prevalent. I think it's highest, among substance users, and alcohol alone often mixed with other substances, it's impacting everybody. But that childcare, that burden, stress in the older population, people work so hard for this stage of their life to be a season of comfort and, enjoyment for all their work and all these responsibilities, the cost of living, so it's tough.
It is. Certainly is. It's challenging times for everybody.
Yeah.
The way we cope with stressors really is going to make or break us, really.
Yeah, and it's maladaptive coping mechanisms, whatever it is. But I think it's just important, like you said, that tough times and like perfect opportunity to talk about something that has been going on under the guise for a long time, and we've got to get out and we've got to educate people, and we have to let them know, just because your alcohol use or you may have struggled with substances during the pandemic, it does not necessarily mean you're an alcoholic or a drug addict of this deep it's going to be life. But like we need to to get people the help they need to, regulate. And like a lot of people that wouldn't have turned to substances during a pandemic, you're at home with your family and your kids, and you're trying to do homeschool and pay the bills and work. I mean, my head is spinning just thinking about it. I have a bulldog, and it was a lot during the pandemic, so we have to let people know it's okay if they're not okay. Mental substance use, that's kind of it's a beautiful thing to say to someone, like, it's okay. Like, you don't need to figure it out. There's people out there. You don't need to do a deep dive into the psychological reasons that you do what you do. Like, there's all these things. There's time for that. Like, let's get you physically and mentally able to do that work. And that's where the partners come in, the community health partners, the programs that they provide in the city of Quincy. I will say the city of Quincy, the mayor has allowed and invited services in this area. Like, Quincy is full of, we have the Detox Gavin Foundation, we have all of these supportive housing, sober housing, halfway houses. And then we have direct care. You can walk in here and get things that would be very difficult to go out in the world and try to get without worrying. And when you walk in here too, your other needs are getting met. They're asking about STDs, prevention in all sorts of ways. Think about how beautiful that is. Linking you up with a PCP to deal with your blood pressure, like all these things. And that's why I love it. Like, when I first started, I was like, how am I going to do all these things? And the answer is simple. I'm not. We are. And I don't pretend to know things that I don't know, because because I don't know. And that's great. Like, please teach me more. We're never going to figure this thing out. We're only going to figure out ways to deal with what we're dealing with, but to share the information.
Yeah, so. I love that. It's a perfect opening for me to ask Ari. Hello, Ari. Can you tell us about what you do and about Narcan training?
Absolutely. So we are part of the prevention and outreach team here at Manit. So as a team, we go out into the community if we know of any encampments, or just walk around the city and surrounding cities around Quincy and meet people on the streets and ask them if they have, connected with PCPs, or if they need other resources, we get them connected with those agencies that they may need to be connected with. When it comes to our homeless community, also same thing, ensuring that they are connected with their mental health providers, their primary care providers, and obviously we distribute Narcan. But Quincy and Braintree is another one of the cities that we are very lucky to be able to do a safe syringe mobile van. And when I say mobile van, sometimes it's literally just us walking around on our feet. So it's our mobile feet safe syringe exchange program. But we also have other supplies to reduce risk, because we just want to ensure, like Laura had said, we have to meet our individuals where they are, and we can't force sobriety on people. And we know that individuals who are actively using are going to actively use, whether we want them to or not. And we just want to ensure that they're using safely. And then we also provide other information about, well, is there other ways that you could possibly be using your substance that is not as risky, that could prevent other illnesses from being contracted? And besides that, we also have, like Laura mentioned, our STI testing, which is free and confidential, whether they have insurance or not. We have funding that can pay for those tests to be ran. So that's basically
a huge part.
Yeah, very huge
insurance.
Yes.
So you can come here for services and they will be provided. That's the financial fear is a huge deterrent for people.
Yeah. So we get a lot of calls from people who ask, I don't have insurance at this time. And if they don't, we obviously get them connected with our financial advisors and say, we can definitely connect you with someone to see if you're eligible for Mass Health and get you your health insurance. So we're not going to just tell them, sure, just come on. And we're here to provide those next steps so that we can, get them connected to those resources that they need.
And another thing too, sorry,
No.
Ari, but Manet's connected with the VA, right? So a lot of the older population, especially with substance use at a high level, you have a lot of veterans, their families, folks like that. So there's that direct, connection, but they really can individualize. Someone comes here, for a safe syringe or Narcan, and the possibilities are endless for where these guys, they are like a bottle of knowledge that I just want to shake and take, which I get to.
And then besides that, we go into detox centers and residential homes that we can give Narcan trainings and STI trainings as well. It's shocking to me, we live in such a liberal state, but how many adults in our state that don't even understand how a disease is contracted, having conversations with grown adults and talk about HIV, syphilis, hepatitis, chlamydia and gonorrhea. And you're seeing minds being blown, and, we can see where our country is going right now, but also, it's just amazing to be able to educate our community.
Okay. Can you, just for people out there who, because you shared a lot of information, both of you, what is PCP?
Primary care physician.
And what do you mean by STI?
So sexually transmitted infection. So I actually had this conversation yesterday with an individual, and I said, he's like, STI, what do you mean? And I said, oh, it's a sexually transmitted infection. He goes, so you mean an STD? And I go, back in my high school years, that's when they kind of changed it from STD, from a sexually transmitted disease, to a sexually transmitted infection. And he was like, oh, so this must have been recent. I was like, that's very kind. I haven't been in high school for over 15 years, but thank you. But yeah,
I didn't know what it meant, so I'm excited that he asked that question.
Well, I'm glad you mentioned that, because even though we're talking about substance use disorder, I've been reading a lot of articles about the older population needing retraining in STIs, because there's a good portion of older adults all the way up to their 80s are, sexually active, which is great for them, but they need that education, re-education, or maybe reminders to have safe sex and to be.
And substance use decreases your cognitive ability to decision making. So it really is, it's hand in hand, it definitely elevates your risk in all sorts of ways. Mm-hmm. Mm-hmm. And add in a pandemic where no one's going to the hospital for regular testing or to talk about these things that are happening. People are getting diagnosed with things that they're probably thinking, how did this happen? And,
Can you, so Ari, can you tell us about what does a Narcan training look like? And is that something that you could share with us?
Yeah, so I'm actually going to go through a quick Narcan training with the group today. Right. So I usually like to start off with explaining what Narcan is. So Narcan is the brand name. It is also known as naloxone. And this is primarily what you're going to be seeing on the streets. It's a single-use nasal spray, very similar to what is like a Flonase. There are other forms of Narcan that individuals may have seen, or, the past, the way they were distributed. When Narcan first was distributed, it was actually a multi-piece Narcan that you had to connect yourself. I have an older one that I've tried to even put together in my Narcan groups just to show people. And to this day, I still can't even figure it out. So I even say, think about if you're in an emergency situation and your adrenaline is rushing, your hands are shaking, the vial itself was made out of glass, it would drop, it shatters, that is wasted Narcan, and then you have to try to go and get your next dose. So luckily, this is now the new form that it is being distributed in. But there's also other ones that you may see. So there's a really cool one that's very similar to like an EpiPen that talks to you. They're very expensive. So this is not something you're probably going to be purchasing yourself. From my understanding, it's mainly like in prison correctional facilities, or even in the military. This is kind of what they have. And it just says, put the Narcan to the leg. It counts for you. And it says, press the button to distribute the Narcan. So that's very cool. But this is not what you're going to be normally seeing. And then obviously we know our EMTs, they're probably going to have an IV that they can connect to you. But for the most part, our police officers and our our first responders are going to have the nasal spray, and they actually come to us or other community health centers to get their trainings and even get their Narcan. So I do also talk about where you can get your Narcan, and that you could go to your police officer, your fire station, but they're probably not going to be super duper pleased with you that you're coming to get their personal stash of what they have. But you can always go to them if that is really your last resort. But just to be clear about what an opiate is, or what is actually happening when someone is overdosing, is different types of opiates. I've discussed this with my groups, and what I really look for is that for people to talk about, well, yes, your prescription medications that you're getting from a physician, it's still possible to overdose on them. And if we're talking about an elderly community, just let's think about something even realistic. They may not even have a drug abuse issue, but if we have someone who's dealing with memory loss, they have, an opioid medication that they're taking. They have to take it in the morning, completely forget if they have taken their medication. They then redose themselves. It's possible to go through an overdose. So let's be clear about that even your prescription medications that you get from a physician, it's very possible to overdose on those. Other types of opioids that are out there, we like to hear there's fentanyl, obviously. We have our oxycodone, we have heroin, and there's always the joke, well, does heroin even really exist anymore? I don't know. But we know that it's mainly probably going to be mixed with something. What's happening to someone who is overdosing is, as some who may know, may not know, is that our brains have receptors that are opioid receptors, and our physical bodies do naturally produce their own opioids. What's happening when you're taking a substance is that those receptors overfill, which leads to the word literally overdosing. And the individuals are actually, what's happening is that they're lacking the ability to breathe. It blocks that ability. They're not going in cardiac arrest unless obviously a long period of time happens without oxygen. Then it's possible they're going to go into cardiac arrest, but they're actually trying to breathe. So some signs to look for is that maybe some discoloration of their lips or their skin. It's going to be turning blue. Why? Lack of oxygen. Some people even mention that there's going to be a death rattle. And what we call the death rattle is a very deep snore in the back of your throat. So I also like to mention, like, if you have a partner that you sleep next to at night and they have really bad snoring, it might sound very similar to that, like sound, because they're trying to grasp that air. They're also going to be unresponsive. And there is a difference between someone being unresponsive to that they're just very, very high, but they are still able to at least get some sort of response from them, as to opposed to an overdose. So what I like to say to people is that let them know that you're going to Narcan them. If they can respond to you and they're just extremely high, they're going to, because Narcan, no one wants to be Narcaned. The reason behind that is because it makes the individual go into immediate withdrawal symptoms. So it's not a fun experience. From my understanding and from what people have shared with us in their personal stories, is that it can cause immediate vomiting, even diarrhea, extreme pain, headaches, and of course they're going through withdrawal symptoms, so they're going to possibly get the shakes. It's not a very fun experience. So don't ever think that you're going to get a thank you from someone, a stranger, a family member, after you Narcan them, because they don't feel very well. But you know that you did save that person's life, and that for yourself, that should be the comfort that you should be looking for. So as I mentioned, I'm going to tell the person that I am going to Narcan them. Prior to that, there's a couple other things that you can try to do to get a response from someone, and it's really trying to get a pain receptor going. So what we recommend is doing a sternum rub. You just grab your fist and you go right into the middle of your chest. That is your sternum. Men and females all have a sternum bone, and you just rub up and down for a couple of seconds. No reason to do this for an extended period of time, because if they're going to respond, they will respond immediately. So again, just a couple of seconds. Let's just say this individual may be hunched over, because it is possible. They're very high, they're, kind of loosey-goosey at this point. They're going to hunch over. I can't reach that sternum. Similar thing, just a couple of knuckles go below their nose and above their lip. And it's on that gum area, which is very sensitive. We know that in our mouths. And again, just rub a couple of seconds. See if you can get a response out of that person. So at this point, we know I called out this individual's name, obviously just to try to get a response. I'm either hearing a death rattle, I'm seeing maybe some discoloration in their skin and nails. I told them I was going to Narcan them. I did the sternum rub. I'm not getting a response. It's pretty clear at this point that this person is overdosing. So what I'm going to do is I'm going to get my Narcan, and this is expired, so I'm going to use it right in front of you. Very easy. I just took it out of the package, and then you spray right into their nostril. It doesn't matter which nostril it is. You just spray it one time. During this time, I'm going to hope that you either have a cell phone readily available or there's somebody else that you can direct and say, can you please go call emergency services? While that's also being done, I would start doing rescue breaths. If you know anything about CPR, it's very similar, but like I mentioned before, they're not going in cardiac arrest, so there's no reason to be doing chest compressions. All we're going to be doing is trying to breathe for them. So what you're going to do is you're going to lift their chin up to open up the airway. You're going to pitch their nose, make a seal with your mouth over their mouth, and you're going to be breathing in for them. What you're hopefully going to be seeing is that their chest is going up and down. If you notice that their stomach is going up and down, it means that you're giving way too much air and it's actually not going into the lungs, it's going into the stomach. So what can happen is that they're going to vomit. And I know for myself, if someone vomits in my mouth, it's just going to be an endless cycle of people throwing up. So that's not going to be fun. So just know that you're going to be trying to see that the chest goes up and down, but it's possible that it won't because our chests are very, strong, or we have our bones there. It's possible it's not happening. Continue to do it. I do get a lot of people saying, we've lived in a pandemic with COVID. You got to be kidding me if you think I'm putting my mouth over someone else's. We do have face masks that we distribute. So it's just right over the mouth. If you don't have that, we recommend using a t-shirt. It's very porous material that you can also use as a shield. During this time, I also say we're calling emergency services. What I recommend for and what we hear from our own participants who come in is that we're just going to say someone is unresponsive. The reason that we say that is because there is stigma. And we talk about this many, many times. Laura has mentioned it many times. There is stigma for our drug users. It's sad to say, but it does happen, is that EMTs, if they hear that it is an overdose, they may not necessarily respond in the most prompt way. That's terrible to say, but it happens. So we say, just say that someone is unresponsive. I can even say I have close friends who are EMTs. We have gotten into very deep debates about the opioid epidemic and why are we responding? Why am I going to the same person over and over again? My response to them is, if you do not feel that you should be there in a prompt manner to save someone's life, clearly you're in the wrong field. But that's neither here nor there. But you can obviously say it's an overdose. If you are comfortable saying it, go for it. They're going to arrive either way. But this is just from personal stories of active users that they have shared with us. During this time, we're going to wait 2 to 3 minutes before we distribute another Narcan. And again, from personal stories from our participants, they're saying they're actually using more than one Narcan to get someone to respond. Unfortunately, I'm hearing about 2 to 4 is the average. So just know, and the reason behind that is because our substances that are on the streets are extremely potent, and fentanyl is extremely potent on the streets. And it just, unfortunately, it's so strong that it requires more Narcan. And because of fentanyl, Narcan is actually being distributed in 4 milligram doses now. Initially, it was only done in 2. So knowing this information, and we're hearing that people are using more than one dose at a time, we may be seeing in our near future that Narcan milligram, the dosages are probably going to go up again. So there's a couple other things that I would like to mention in regards to how people are being protected and what laws can be, are in place to be able to protect our user and the individual who's overdosing. Because, obviously, if EMTs are being called, police are going to arrive. So there's something called the Good Samaritan Law. And to be clear, that only protects from getting any possession charges for the individual who overdosed and the individual who made the phone call to the EMTs. So if there's other individuals around, I would recommend that you ask them to leave or they get away from the premises, because police can ask them and can search them, and we understand what police officers are there to do, and so that, arrests could happen. But the Good Samaritan law is there to protect, again, the individual who overdosed and the individual who made that phone call to emergency services from getting any possession charges. There are a few loopholes. They are called the 3 Ws. The 3 Ws are any weapons, so unregistered weapons. If you have a weapon on you, please ensure that you are registered to have that weapon, have your documentation with you. If you are not registered to have that weapon, please get rid of it, or maybe you should not be the individual sticking around. Police are going to search and they're probably going to see it and say, why do you have this? So that is a reason to get arrested. Warrants. Yeah. So if they come over and they see, let's just say with myself, and they say, hey, Ari, good to see you, and be like, oh, yes, they're probably going to be like, all right, we've been looking for you. You never know. You might have a really great cop that if it's just, a local warrant, they're going to like, Ari, go get yourself some help, or, go to the hospital with your friend. Please take care of your warrant. If it's a, federal warrant, they're probably going to get you in that moment. So just be aware of that. And also weight. So if it appears as if, the amount of substance that is at the property or on the person is more than what was for personal consumption, and it was obviously going to be distributed, police are going to take note of that, and you can also get in trouble. So if they see any bags, scales, this is obviously ding, 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 this is not for personal consumption. So those are the 3 Ws that are the loopholes that, yes, police can get you on, and you can get arrested for those if you're at the area of a overdose. And a few other things that we like to mention, any signs of children. So even if it's shoes, toys, the police are going to take note, and DCF is going to be called. So please be aware of that. An example that I always use in my groups is I say, let's just say you have custody of your children on the weekend. You have your child that weekend, your friend comes over, you had no idea that your friend was using, they overdose in the bathroom or anywhere in your home, and then EMTs arrive, they're going to call DCF on you, even if you were not the individual who was overdosing or was using. They're there to protect the child. So DCF is going to be called. Another thing I like to mention is that if you're in any federal, state housing or state funded housing, there are disclosures in people's leases saying if there's any drug use or any overdoses on property, you can lose your housing. It's happened. I've seen it happen. I used to work at Father Bill's as a rehousing manager, and I actually worked with an individual who she was not the individual using, but police came to her unit. There was drug use there, and she lost her housing, was homeless for a year. We were able to appeal it, but that was still a year of her being homeless before she was able to get her housing back. So please be aware of these types of things. And I do also put out that disclosure that our private landlords are also getting smart. They're putting this information into their leases, so please read your lease prior to signing it.
What about where to get it?
Where can you get your Narcan? So where we would say, obviously, any community health center will have Narcan for free. So you can come on down to Manit. We have a quick form that we have to complete for the state, just some basic information, nothing that is going to say this is individually you. So there's no reason for you to be frightened that, why is the state asking if I'm getting Narcan? And you can obviously, like I mentioned, if it's the last resort, you can go to your police department or a fire station. You can also go to your local pharmacy and you can get Narcan without a prescription. You can either pay out of pocket for what the Narcan is, valued at, or you can use your health insurance and use your copay. So if you have Mass Health and you have no income, just let the pharmacist know, I have Mass Health, I'd like to go through my insurance, I have no income at this time, and they'll waive the fees. In the state of Massachusetts, there's an open to carry label that's going to be on the back of your Narcan that just basically says that anyone can have Narcan. It's no reason to have a police officer search you. If they were to see the Narcan, have that be probable cause that you're an active user. I myself am not an active user, but I keep Narcan with me at all times. I actually have begun to give it out to my friends as birthday gifts. Initially, it was a bit of a joke and just saying, you never know when you're going to need Narcan, but now I'm being very serious. You never know when you're going to need Narcan. A couple of things I want to discuss before I finish out is what can put someone more at risk of an overdose, and that is mixing substances. So if you were to think about, well, I'm going to be using a stimulant and then also I'm using an opioid at the same time, those are kind of counteracting each other. So obviously the opioid is making you more snoozy, more relaxed, depressed with breathing. Your stimulant is obviously making you very hyped up. So you may even believe that I'm not getting as high as I normally do. I can continue to use my substance, and then leads to an overdose. Others can be switching your user. Not your user, your dealer. So if one dealer may be producing their substance in one form, another one may be mixing it completely different. Any time of sobriety, especially if it's forced. So one thing I would like to bring up is that in the state of Massachusetts, women are no longer being sent to correctional facilities if they're being sectioned 35. A section 35 is if a family member or physician believes that you are at risk for yourself and your safety due to your substance use, but men are still being sent to correctional facilities. There is a reform in Massachusetts that's trying to be passed that men are not going to be sent to correctional facilities if they were to be sectioned. So I do mention, if you are registered to vote, to please go talk to your local representatives. But men should not be sent to correctional facilities. I don't think that's political. I think that's very obvious that our correctional facilities are not meant to be there for detoxing. And yeah, that's pretty much it for my spiel on Narcan.
Great. Wow. So as far as if somebody wants to get Narcan and they go to the Manat Community Center, how many Narcans are they given? Is it one or two?
So each package comes with 2 Narcans in it. So that's about 8 milligrams. Like I mentioned, each one is 4 milligrams, but we can give an individual as many as they need. Our form, the state does ask if you're giving more than 4 doses of Narcan, what is the reasoning? And we just put a quick note, may need more doses. May not be locally located. They are coming in once a month, or that, they may be picking up for their own even facilities. And people have been coming in and say, oh, I work at a yacht club. We want to put this in our first aid kits. Can we get, 16 packages? Not a problem. We can definitely put that in.
And in the city of Quincy, we have them through Manat helping in the first aid kit. At the Thomas Crane Public Library, which is really important. And Ari made a joke of it, handing it out for birthdays, but I do believe that it should be largely distributed in public buildings, even if it's a building that someone may not think, oh, well, someone's going to be actively using. We're a vibrant city, we're a community, and why not? So that's kind of what's sad that we need so much, but great that just like we're changing with the way we treat people with addiction, changing access to life-saving resources is decreasing the stigma, right? It's like you have an automatic electronic defibrillator at a gym because there's a high risk of someone going into cardiac arrest because of that increased activity. We're in the middle of an opiate pandemic and we have substance use left and right. And we're a major city, and this doesn't matter for a major city, towns. We need to talk about this stuff.
Yeah.
And it's available, and it should be available. And I love how you went through all the laws and those things, and some of those are, you wonder well, should there be that? But we got to let people know, because not knowing will just make them think they can't, which is dangerous. But
I really want to thank you, Laura and Ari, for today's program and just really sharing, your knowledge. And clearly both of you are so passionate about what you do. And thank goodness there are people like you who are out there, trying to do their best to help people.
Without her, my job is not complete. Without me, vice versa, and that it's like you come together for any other cause that matters. These are lives, and yes, I'm blessed to have a job where I get to try to educate people, but also to have compassion and give people some dignity and grace for what they suffer with, and which is what, Manic has taught me so much about too, personally. So I want to thank you.
Thank you again. I want to thank the City of Quincy's Health Department for continuing to sponsor this program. Thank you again, Laura.
Thank you.
Lori, have a great day.